Greetings of the season. I am Dr. Vijay Varad. I am an allergist and clinical immunologist with the experience of more than 25 years practicing in Pune. Dr. Varad Sai Allergy Asthma Eye Hospital, along with my spouse. She's an ophthalmologist and she's also specialist in eye allergies. Last 27 years, the research also we are doing in asthma allergies and upgrading ourselves to give the best services to the community. Specifically, looking at the scenario into the community, how the diabetes and blood pressure, people know about that. But about the asthma and allergy, whatever the recent advances are happening in the world, still regarding those practices, in Indian scenario, there is a lot of communication gap. As children with asthma, 90% have underlying allergy. Adults also 65 to 80% have a underlying allergy. So what does it allergy means? Allergy means it's a hypersensitivity of the body reacting to the regular contact allergens like dust mites, pollens, insect droppings, dried feathers, pigeon feather, pigeon droppings, funguses or molds, as well as foods, whatever we consume regularly, even the lentils, nuts, non-vegetarian foods, milk, some fruits or vegetables. The patient was eating previously also, but one fine day, they developed this allergy to this type of allergens. And asthma is the most common in children as a chronic disease. But along with that, even the children with eczema or atopic dermatitis has increased a lot. Then gastrointestinal symptoms like infantile colics, repeated stomach problems, or vomitings, it's called GERD also. Then allergic cold, like repeated cold, repeated cough, even tonsils, adenoids, throat infections, sinusitis, eye allergies, repeated ear problems, then skin allergies, even including the urticaria, or it is called a pitta, amla pitta in India, repeated stomach problems, gastrointestinal disturbances, indigestion of the food. There are so many like these symptoms of allergy. And still in India, the standardized, accurate, modified allergy testing awareness is lacking. And so many advertises are done into the newspapers, and the people are still doing the old ELISA method allergy test, which are not that much accurate. While that standardized, accurate skin allergy testing, which are modified, even they are done with the specific Lancet, which is hardly 1 millimeter, penless, bloodless, which has an accuracy of more than 95%. These are the gold standard allergy test. And all these scenarios, what I mentioned, from sinusitis to ocular allergies, eye allergies, to nose, to throat, asthma, skin allergies, or food allergies. These skin allergy tests are the best one because they pick up the specific Ig for the specific allergens, which is bound to the mast cells. There are other specific Ig blood allergy tests also. One is a immunocap, and another now the latest is the component resolved diagnosis, where even the components of the or epitopes of the foods, like suppose there is a peanut allergy, so there are different type of proteins into the peanut. So some of them really cause a severe reaction. Even it detects the cross reactivities. What does it mean? Suppose somebody has some grass pollen allergies. So some of the fruits like banana and all, after eating that, the patient gets the symptoms. So these also can be picked up with this component result diagnosis. Even last 2 years in our Psi Allergy hospital, we are having this machine where the artificial intelligence has been used and we can detect these epitopes or different proteins into the food also. If anybody wants to do an allergy test, ideally he should visit to a qualified, experienced allergy specialist, and then we take a detailed history about the patient, about the family, the exposure of the patient, whatever the food, his lifestyle, and then we select the important allergens for that specific patient. If the patient go to the panels of test, whatever advertised, it is not useful to the patient. But when we select these specific allergens, it is more useful to the patients. That's why then according to the family history, suppose somebody in the family has first degree relatives, parents, grandparents, somebody has some or the other allergies, then it becomes more easy to pinpoint for the specific allergens. And those skin tests are hardly millimeter size indurations are there, like after the mosquito bite, how we have millimeter size. So it is very painless. So after 20 to 30 minutes, we diagnose those allergens and then we guide you like what type of precautions should be taken. And those things, we cannot avoid it, specifically dust mites, pollens, insect droppings or dried feathers and all. Then we